Am I audible as well as visible? Let me know. Let me check. Am I audible and visible? Hello, everyone. Okay. Am I audible, visible properly? Let us start. Here in this channel, Unacademy Future Doctors, we are starting crash course for first MBBS students, those who are going for the exams, university exams. So these videos, they will be very helpful for the MBBS students, those who are appearing for first MBBS university exams. So if you have anyone either as your junior, as your friend or family member, you can please share this channel as well as all these videos. These are very important. I will share with you questions regarding the university exams. We will discuss questions also, which questions will be important in your university exam regarding this topic at the end. Okay, so let me first explain something about myself, that I am Dr. Dipti Kariya. I'm MD PhD Physiology. I'm Associate Professor and educating MBBS nursing and physiotherapy students, and I have teaching experience of more than 70 years. Let me explain about our subscription. We have Plus subscription, in which you can choose the best from the best. In Plus subscription, you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators. You can access question bank, which is having more than 25,000 questions. You can compete in the test as well as quizzes. And within 12 months, we are coming with our printed notes. Now, next is our iconic subscription. Here in iconic subscription, you are assessed to the best from two of the best. Okay, which are these two? One, that is Unacademy and Prep Ladder. With Unacademy features I have already discussed, and second one, that is Unacademy and Prep Ladder with Prep Ladder. Okay, which are the features here? You can have clinical and integrated essential. You can have videos from video lectures from the dream team. You can have question bank 3 with active guidance as well as system tags and much more. You can have rapid revision and snapshots, treasures in 2021 dream notes. Okay? So you can subscribe from your mobile. You can subscribe either Plus subscription or Iconic subscription. You can use my code DIPTI10 and you can get 10% discount. Okay? Longer the duration of subscription, cheaper are the rates. Okay? So I'll suggest, if you're first MBBS student, you can go for the longer duration subscription. Okay. Now let us another more thing that I would like to discuss with you, that on this November 28th, tomorrow, we'll be having a NEET PG combat, that is at 5 p.m. Okay, tomorrow at 5 p.m. and you can get a chance to compete with India's all the learners. Okay, you can get a chance to win scholarship also. You can win scholarship about 100%. Okay, if you received first rank, then you can have a scholarship plan. Okay, now next is, here you can see, again you can enroll with my code for free enrollment. Okay? Again, dates, please note down, that is tomorrow 28 November at 5 p.m. Okay? Already I have discussed, rank 1 get 100% scholarship, rank 2nd to 10 get 75% scholarship, rank 11 to 50 gets 50% scholarship, and 51 to 200 gets 25% scholarship. As well as top 100 rankers, they can win Amazon vouchers. Okay? Now, let us continue our topic, that is importance of blood groups. Yesterday we discussed about blood groups. If you have missed the video, you can go through the same video from our channel Unacademy Future Doctors. One of the very important topic, that is blood groups. Okay? Now, Here today we'll discuss about something regarding mismatched blood transfusion reactions, and importance of blood groups. And at the end, we will also discuss about certain anticoagulants. This all will be asked either as short notes or long questions. Okay, so you just be attentive. Very important aspects are there. These are very important clinically also. Blood groups are very, very important. Blood transfusion is also very important when you face patients in your clinics. Okay? So, what are the importance of blood groups? First, that is medical important. Medically, it is important during blood transfusion. You should never, as I told you yesterday, you should never transfuse blood without matching. Okay, if the person is having A blood group, you should never give the person with the blood having B blood group. Okay. Second, that is social. Here, there is blood donors club we can maintain. Social importance is that. So sometimes if somebody wants blood, so he or she can easily get the blood, because we know that how many different blood group bags we have. Okay. Third, that is, it is important for preventing hemolytic disease of newborn. Suppose if we are not knowing the blood group of mother, how can we prevent the disease? Mother's blood group is negative, we discussed yesterday. Okay? So to prevent it. And judicial medical legal cases, if suppose there is a red strain, and this red strain that is separated from blood stain, or it is because of something else, that is the importance of blood group. If it is blood, then it must contain RBC, and RBC having all this antigen. Okay? Now, another important this use of the knowing blood group, that is for paternity disputes. Paternity dispute, it is not very much specific, but we can use it. Specific test for paternity disputes, that is DNA fingerprinting. That is 100% effective or efficacious. Okay. Now, so how can we roughly find out that whether this person is father or mother of the individual? So here, if suppose child's blood group is O, okay, whatever is the blood group of mother, if father's blood group is AB, the person is not father of this child. Okay, you can know that because we all know that A and B, they are dominant genes. So if any of the gene comes from father, then the baby's blood group may be A or B or AB. Okay, so this is one thing. Second thing, if child's blood group is AB and father's blood group is O, then this is also not possible, because A or B, one of this genotype must come from father. Okay, so this way we can get the idea about paternity dispute. Now, let us discuss about blood transfusion. Blood transfusion means when we are transfusing blood from one person to other person. Okay? Now, which are the indications for blood transfusion? When do we require blood transfusion? So first, that is blood loss. If there is excessive blood loss, and this is the indication for blood transfusion. Causes are acute or chronic. Acute cause is either it is because of accident. Suppose there is accident and the person lost about 2 liters of blood. So we immediately require to transfuse. That is one of the indication. Or surgery. During surgery, if severe blood loss is there. Ankita Pandita. Hello, hello. Okay, welcome. So acute blood loss indications are either because of accident or surgery. Third, that is postpartum. What is this postpartum? Sometimes after delivery of baby, when placenta is delivered, large amount of bleeding is there, and this may be life threatening for mother. So here it requires blood transfusion. Okay, so these are acute indications. Then chronic indications. Chronic indication means if the person is having chronic anemia. Anemia is there, severe anemia. If hemoglobin is 3 or 4 gram, normal hemoglobin, I think all of you are knowing. Normal hemoglobin is, female it is 12 to 16 gram percentage. Okay, and for males that is 14 to 18 gram percentage. Okay, So here if it is very less in anemia, then also blood transfusion is required. And another indication is thalassemia. In thalassemia also, because there is hemolysis, person requires blood. Okay, now, so this is first indication, blood loss. Second is blood disorders. Some blood disorders like hemophilia. What happens in hemophilia? There is deficiency of factor 8, factor 8 deficiency, or purpura, platelet deficiency. When there is severe bleeding, so we require to give blood or this factor. Blood diseases like anemia, leukemia, they also require blood transfusion. And in burns also, not blood always, but in burns we can give other substitutes of blood, like plasma we can give. Okay, now before blood transfusion, which precautions we require to maintain? Okay, so here you can see, first of all, before blood transfusion, if we are transfusing blood from one person to another person, so which are the criteria? One is age of the donor. Age of the donor must be between 18 to 60 years. Okay? 18 to 60 years. The person is healthy individual, having hemoglobin more than 15 gram percent. Okay? Otherwise, what happens if suppose the person himself is anemic, then if we are taking blood, then the person becomes more anemic. Okay? Then hemoglobin must be this. Person should not be having HIV or HBS or any other disease which can be transfused. Okay? Pregnant and lactating mother cannot transfuse blood, cannot give blood. Okay? So, second, so this is first criteria. Second thing, only compatible blood must be transfused. Compatible blood means A to A, B to B, positive to positive. So that is compatible blood transfusion. RH positive blood never given to RH negative mother or negative person. Otherwise, delayed transfusion reactions they occur. We will discuss. Cross matching is required. Cross matching means suppose both donor and recipient's blood group are same A, but still donors RBC we have discussed. Donors RBC plus recipient's plasma. This to be mixed. अब इन दोनों को mix करना है. Then only we can give blood. So this is cross matching, very important thing. Now, so these are the precautions before transfusion. During transfusion, we have to use sterile instrument. Sterile instruments should be used, otherwise we can transmit HIV or other disease. Temperature of the blood should be at body temperature, because we are storing blood in the at lower temperature, about 4 degrees Celsius, and our body temperature is 36 degrees. So it should be reached up to this temperature, otherwise the person is having shivering and other reactions, and transfusion must be slow. Okay? Otherwise circulatory overload is also maybe there. Now, transfusion reactions. This transfusion reactions means what happens when we are transfusing blood from one person to another person. Okay? These are divided in one, that is due to mismatched blood transfusion. That is, suppose you have given A blood group to the individual with the B blood group, that is mismatched. This is very, very, very serious and fatal. You are killing the person if you are doing this thing. Okay, so now what happens here? What happens if we are doing this thing? Suppose somebody's blood group is A and we are giving this blood to the individual having B. Okay, so what happens here? This is donor. Donor's blood group is A. Recipient's blood group is B. Okay? So recipient is having anti-A. According to Landstener's law, we have discussed. So what happens? Donor is having A. This anti-A react with the A antigen on the RBC. Okay? So first step, what happens? There is hemolysis. RBCs are destroyed. This A is present on the surface of RBC. This anti-A binds with A and there is hemolysis. Okay? Now, so that is first thing, hemolysis. And because of that, there is hemolytic jaundice. Then hemoglobin is released and hemoglobin passes through urine. Okay, that is hemoglobin urea. Next is renal failure may occur. How? Because this hemoglobin, when it passes through urine, it causes blockage of the renal tubules. And then because of that, there is anuria. Anuria means urine output stops. So what happens? Toxic substances cannot be excreted and the person is having renal failure. So because of damage to the renal tubules, there is renal failure. Other cause for renal failure is sometimes what happens because of release of this toxic substances from destroyed RBC. Okay, so what happens? These RBCs are destroyed. Okay, these are RBCs. So what they do is they release toxic substance. And this toxic substances, what they do is, this is our, you can see, this is our afferent arteriole, efferent arteriole, glomerulus, kidney. In kidney we are talking about. So what happens here? That is, these blood vessels are constricted. So now blood flow stops. When blood flow stops, kidney cannot do the function of filtration. So this is second cause for the renal failure. Third cause is because RBCs are destroyed. Okay, and some toxic substances are also released. So what happens? Because of that, blood pressure decreases, and when blood pressure decreases, again there is decreased blood flow and kidneys, they cannot function. So there is renal failure, and because of renal failure there is coma and death of the individual. So this is very serious. If you are doing this, then the patient will die. So this is very important clinically also. So if suppose your staff has checked the blood group, still it's your job to check that whether the blood group is compatible or not. Compatible means donor's blood group and recipient blood groups must be same. Okay, this is, so that is first reaction. Second thing is circulatory overload. Circulatory overload means what happens here? Suppose we have given 500 ml of blood. What happens? This 500 ml is added to our 5 liters of blood. So this, if we are giving very fast, then that causes increase in the blood volume. Volume increases, and this is commonly seen if the your patient is having cardiac problem. So in cardiac disease and renal disease, this transfusion may produce this circulatory overload. Okay. Third thing is we are transmitting blood-borne disease. Blood-borne infections are HIV, hepatitis, malaria, or syphilis. They all are transmitted from blood. Okay. So these are all. Fourth reaction, that is pyrogenic reaction. This question is very important. It will be asked in your exam, that transfusion reactions. Which are all these reactions? You can write down all this. One, that is renal shutdown, we have discussed because of mismatched blood transfusion. Second, that is circulatory overload. Third, that is transmission of blood-borne infection. Fourth is pyrogenic reaction. Here, it is characterized by the person is having fever and chills because of entry of pyrogen. Pyrogen means pyrexia, means fever producing substance. Okay, that is because of destruction of WBCs. You can see here, WBCs are destroyed by these antibodies. If suppose antibodies are there in the blood of donor, then they destroy WBCs. WBCs are destroyed, and because of that, this kind of fever is present. Then allergic reaction. So if suppose donor's blood is having allergic substance, so what happens? The person is having allergic reaction. And allergic reaction is in the form of the person is having rashes on the skin, and sometimes the person may have asthma also. Hyperkalemia, potassium level increase. Because potassium concentration is more in stored blood. In stored blood, large amount of potassium is there. Why? Because sodium potassium pump is not active. So sodium cannot go out, potassium cannot enter in, so potassium level increases outside, and that produces hyperkalemia. Then hypocalcemia, calcium level decreases. Why? Because this blood, for storage of blood, we are adding citrate in the blood. So this citrate combines with calcium and it forms calcium citrate. So calcium from the blood decreases. So this is the other consequence. Now, next variety of blood transfusion is autologous transfusion. Autologous transfusion means the person can take his or her own blood. Suppose if surgery is elective, means planned surgery is there. So in that, person can submit his or her own blood and can take the same. Or sometimes during surgery also, because of with the help of cell saver machine, cell saver machine, one can get the blood and can reuse it. So that is autologous transfer. Now, storage of blood. Here, how can we store it? 1 unit of blood. 1 unit of blood means this is 1 unit. This is a bag which contains 1 unit. 1 unit of blood bag. It is having 420 ml of blood and remaining 120 ml of ACD mixture. Now, what is this ACD mixture? A means acid citrate. C means trisodium citrate. D means dextrose and distilled water. So these all are present in blood bag. Now, what is the role of each? Dextrose is present because dextrose provides energy, glucose. Energy is provided, okay, by dextrose. And this energy is required for sodium potassium pump. All of you know this pump is present in all the cells in RBCs also. Citrate, that is anticoagulant. So this blood can be stored for 21 days and can also be stored if we are storing it at 4 degrees centigrade, it can be for 35 days. Now, what happens to RBCs in the stored blood? These RBCs are swollen, you can see here. Why? Because dextrose is used up. So now there is no glucose or reduced dextrose. So what happens? This is suppose RBC. RBC membrane is having sodium potassium pump. This one. This sodium potassium pump requires ATP. And from where ATP comes? By glycolysis. Glycolysis requires glucose. Okay. So what happens now? The sodium potassium pump is not active because glucose is used up. So what happens here? Sodium ions cannot be exited. Now sodium concentration inside increases, along with that water also increases. Okay? So what happens? RBCs are swollen and sometimes they become spherical. Okay? As well as stored blood, we cannot transfuse WBCs and platelets. Okay? This WBCs and platelets, they are absent after 24 hours, so we cannot transfuse blood if it is after 24 hours. For that, so if we want to transfuse platelets, we should give fresh blood, okay? Then only we can transfuse platelets. Okay? Now, after transfusion of platelet, RBC survival rate is also reduced. 1% RBCs are destroyed per day after transfusion. Okay? Now, which are the indications of blood transfusion? One we have already discussed, that is accident, anemia. Some other are hemolytic disease of newborn, neonatal jaundice, severe anemia, sickle cell anemia, okay, toxicity, severe polycythemia, toxicity of certain drugs. Now, sometimes we can give blood substitutes. Now, what is this blood substitutes mean? Substitutes means instead of blood, if suppose we did not require blood, so we can give some other thing. Like suppose the person is having burns. In burns patient, there is fluid and protein loss. So what we can give is, we need not require RBC. So we can give plasma. We can, if suppose the person is having diarrhea, vomiting, so we can give 0.9% sodium chloride. If the person is having hypoglycemia, 5% glucose. And if the person is having loss of this albumin and gelatin, so this colloids also can be given. Next is exchange transfusion. Here what we can do is, we are removing the blood from one side and we are transfusing blood from other side. This is exchange transfusion. Okay? Now, commonly it is indicated in the newborn babies having hemolytic disease of newborn. Hemolytic disease. So what happens? Why? Because in hemolytic disease, the newborn baby is having antibodies against D antigen, and they destroy this D antigen. So what we do is, instead of positive blood of baby, we are replacing it with the negative. Autologous transfusion we have already discussed from the same person. This also we have discussed. Now next is anticoagulants. Now, what are these anticoagulants? Anticoagulants are the substances, they prevent coagulation. They are used in vivo and in vitro. In vivo means inside the body, and in vitro means outside the body. And some are both in vivo and in vitro. Okay. So first one, that is heparin. Heparin is natural anticoagulant. Here it is produced by basophils and mast cells, in the liver cells also. Okay. And this heparin, how does it act? You can see here heparin. These four are the mechanisms of action. These are very important. Here it inhibits, you can see here, it inhibits the action of thrombin. This is red color is inhibition. Thrombin is inhibited, so blood cannot coagulate. It activates, this green is plus sign, antithrombin 3. And antithrombin also inhibits thrombin. Second mechanism. Third mechanism, it removes thrombin from the circulation. And fourth one, it inactivates factor number 9, 10, 11, and 12. 9, 10, it is written here. Okay, so these are the mechanisms of action. Now, clinical use of heparin is, it is as in vivo anticoagulant. In vivo means sometimes we can give this before surgery, before cardiac surgery commonly, before dialysis, because otherwise what happens, the person is having blood coagulation if we are not giving it. Okay, so in vivo or sometimes outside the body also it can be used. Okay? And disadvantage here, it is very costly, so we can use it cautiously. Next is coumarin derivatives, that is dicoumarol and warfarin. Here, what is the mechanism of action? You can see here, this one, this coumarin derivatives, they are vitamin K antagonist. So what they do is they inhibit vitamin K. So vitamin K is required for the synthesis of factors 2, 7, 9, and 10. You can see here this one, 2, 7, 9, and 10. So these all factors are absent or reduced. So what happens? There is no blood coagulation. And this coumarin, that is oral anticoagulant. Oral tablet can be given at the before surgery, before a night before surgery, we can give this oral tablet. Okay. Next is EDTA. EDTA full form is ethinyl diamine tetraacetate. Okay, it is strong anticoagulant. How does it act? It is a chelating agent. So it chelates calcium ions. So calcium ions are chelated, and because of absence of calcium ion, blood will not coagulate. Okay. Next is oxalate compounds. Oxalate compounds, they are also important anticoagulants, and they are also calcium chelating agents. Okay. Here we can use oxalate with ammonium and phosphate oxalate mixture is used. Okay. Citrate compound, that is also calcium chelating agents. They are used in the blood banks. Okay. Blood bank, acid citrate dextrose or citrate phosphate dextrose mixture plus blood that is stored in the blood bank. This is also calcium chelating agent. Okay. Other substance, sometimes snake venom is also used, but nowadays it is not used. Snake venom also is having anticoagulant property. Okay. Physical methods to prevent blood coagulation, that is we can store it as a cold temperature to prevent activation of clotting factors. One, that is container. Second thing, that is container should be having smooth surface, and third, silicone coated container, so this clotting factors cannot be activated. Okay, so this is all about blood transfusion. Important questions, please write down. Okay, so one, that is, these are the short notes. One, that is mismatched blood transfusion. Second, discuss clinical significance of blood grouping and indication of blood transfusion. Explain complications of mismatched blood transfusion. This is one of the important questions. So many times the question will be asked. Explain the complications of mismatched transfusion, blood transfusion hazards. Okay, so these are the various ways by which the same question was asked previously. Sometimes students may ask me that, madam, answer would be same in all this, but these are the ways by which you will be having your question. Okay, so this is all about today's topic. Thank you.